repeatedly pronounced last rites for President Trump's effort to replace Obamacare. And there was a subdued and skeptical tone after the House pushed it through on a narrow party line vote.
Celebrating at the White House.
How am I doing? Am I doing okay? I'm president. Hey, I'm president.
House Republicans resuscitate their health care plan.
It died right here on the floor. Now it's come back to life, like a zombie.
But major hurdles await why even Republicans in the Senate are saying it's far from a done deal.
But lawmakers voted without the final bill ever being scored, as they say in Washington, meaning they voted without knowing exactly how many fewer Americans would be insured.
Joining us now to analyze the coverage, Erin McPike, White House correspondent for Independent Journal Review. Gayle Trotter, a political commentator who writes for The Hill and Town Hall. And Elleithee, director of Georgetown University's Institute of Politics, a former DNC official and a Fox News contributor. Erin, are the media portraying the House vote as a major victory for President Trump or just kind of a modest, moderate interim step?
Oh, I think the media are portraying it as a huge victory, but it really is not a huge victory. I mean, the House has passed some kind of repeal, and at least repeal, not maybe a replace, 54 other times. It was a big deal when they couldn't bring it to the floor in March to vote on it then.
If it was a big deal when they couldn't bring it to the floor, and that was rightly reported as a setback for Trump.
It was, because they voted on it 54 other times.
Why is it not an equally big deal that they brought together the factions and passed it?
But this is the thing. I think it is being portrayed as a huge deal, but it's got a long way to go before it becomes law, and we keep hearing from senators saying they're going to rewrite this entirely.
When the House didn't vote, and everybody said this was a big failure, a big legislative priority of the president's, there was a lot of obituaries, and MSNBC's Lawrence O'Donnell said, his presidency effectively ended. He is a powerless president. Bit of an overstatement in retrospect?
Oh, certainly. And I would disagree with Erin, too, because I would say that the media are not representing this as a victory. And like you said, the same media that were hooraying President Trump and the congressional Republicans for failing to get this passed in March are not giving him even the credit of a partial victory, which he is due. They are entitled to claim it as a partial victory.
No. By The Hill, by the New York Times, by the Washington Post, by CNN, I have actually seen it called a huge victory. It is very much being portrayed as a huge victory, and it's just a step.
Well, the articles that I have say that the House Republicans and President Trump claim that it's a victory. They're not saying that it is a victory.
It's really, if anything, it showed that Paul Ryan could actually do his job. It shouldn't say that much about Trump, but it is being cast as a huge victory.
I think it's been cast as a bit of a win with a big, fat asterisk. And, the press can either focus on how Donald Trump and Paul Ryan brought these warring factions together to get this through the House, which even a week ago most of us thought might be impossible, or how hard it will be to pass in the Senate, which there's also something to support that.
Well, I don't think it's an either-or. I think the press is actually doing both. I tend to agree more with Erin here. I mean, you watch, I think a lot of the press portrayed this as a needed victory for the president, who did have this big stumbling block the last go-round. But they are adding this asterisk that, you know what, there is a lot further to go. And we're hearing that today on one of the other networks this morning. Senator Susan Collins said Senate Republicans are going to start from scratch. They don't believe that the House bill will take care of people with pre-existing conditions the way the House leadership says it does. And so there is a long way to go. And I think that at least, I'm a cable news junkie. I watch it all day in my office. Everything I've seen kind of pushes both sides of that.
They have medicine for that, by the way.
I know.
All right. Now, but let's look at some of the more extreme claims that are being made. Let's put up a headline from the Huffington Post. This is right after the House vote. Banner headline, House votes to let them die. Doesn't this kind of inflammatory rhetoric kind of discredit the liberal side of the media? Let them die.
Yes, and I do think that there has been a lot of going overboard on some of this coverage. But here's how I'd say that 30,000-foot view, when the vote didn't come, when they didn't have the vote in March, it was actually a lot about substance. People knew it was in the bill. The CBO had scored it, and it went down over policy. This time, the coverage was all about the drama for getting the win, and so little of it was actually about policy, except for the amendment that dealt with pre-existing conditions.
Okay, but so aren't there legitimate questions for the press here, leaving aside the sort of let them die rhetoric, about how much pre-existing conditions will be covered, particularly in states that opt out? Is there enough money to pay for that coverage? How much will premiums go up? I mean, part of the press's job here is to be skeptical about what this bill would do.
Right, and mark this day as an important event that I'm giving the Washington Post credit for calling 4 Pinocchios on the claim, the outrageous and spurious claim that sexual assault is a pre-existing condition. So even the press
was widely repeated in a
yes,
number
it
of
was.
news lines. There's nothing in the bill about it. We can get into the nuances of, well, what if you need treatment or medication? But you're saying the press did its job there.
Yes, absolutely.
But is the press at the same time sort of glossing over the existing problems with Obamacare? The people who have lost their coverage or have to pay a whole lot more, the states where the 1 or 2 insurers left. It seems to me a lot of the coverage suggests that the status quo is fine, but Trump's bill would change it, and that's a bad thing.
Well, I don't think you can say that the press has treated Obamacare with kid gloves over the past 9 years. I mean, it has been.
How about over the past week?
But over the past week, the question now is, I think everybody, Democrats and Republicans, accept the fact that Obamacare needs some adjustments, needs some fixes. The Republican plan doesn't say fix, it says replace. And so it makes sense that the press would focus on, well, what are you going to replace it with? And when you have Republican members of Congress, after casting the vote, going on the record to the press and saying, we actually didn't read it, that shows a huge
Which actually
concern.
sets up my next question, and it's a hypocrisy question. When Obamacare was pushed through, when the Democrats controlled Congress and the White House, conservative pundits complained that they had to pass the bill in order to know what was in it, which was a Nancy Pelosi quote, the way it was rushed through. Now, liberal pundits are complaining that lawmakers barely had time to read these things. A number of Republicans said, no, we did not have time. And there's no score, meaning the CBO hasn't said how much it's going to cost. And it just seems to me that they've switched sides, making the same.
Sure, but Republicans were the one who made that point, right? So that's where that comes in. Republicans wanted to know what was in it when Pelosi was talking about it. So I think they have to live up to that own standard. Absolutely.
But the Democrats did the same thing, is my point. And
but they don't care about reading it. So she's saying it's hypocritical for Republicans to care about that and not do it.
Does the press give President Trump credit for this? He ran on, I don't want to take insurance away from anybody. And however, whatever you think of the compromise, and it's a convoluted one on pre-existing conditions, he basically pushed the House to come up with something where at least they would try to have the impact of this bill not kick people off the rolls because they had a previous medical problem. In other words, he took a more moderate stance than House conservatives.
Well, but I think the challenge is the details of the bill don't bear that out. Yes, he said it. Yes, he went out there and said, even the day before the vote, that I want to make sure people with pre-existing conditions are covered. But this bill does not guarantee that, and it also kicks a lot of people off of Medicaid. When you add those two things together,
well, potentially.
And then but it doesn't
state,
guarantee it, which was his promise, was to guarantee this, and then the next day he's standing there in a Rose Garden ceremony declaring victory over something that did not guarantee what he promised it would guarantee.
Well, let's pull back a little bit, Gayle, because Charles Krauthammer, who is not only a smart conservative but has a medical degree, said that Obama's legacy here is that essentially he has moved the debate to the left, that because Republicans are now talking about at least attempting to deal with pre-existing conditions, there are other parts of Obamacare that have been kept, people up to 26, stay-on parents, all of that. The Freedom Caucus sort of had to go along with that. In other words, how much has the political debate moved from where it would have been 7 years ago?
Right, and I've written extensively about this. Once you have a big social entitlement program passed through Congress, it's very hard to ever roll it back. But the American people, 70% of them want significant changes or repeal of Obamacare because you have narrow networks, increasing premiums, skyrocketing deductibles, and so many insurers are pulling out of the states, so there are no options left. So this is coming crashing down on the Democrats, and the coverage has given short shrift, like you said, last week. It's not just the 9 years. But in the last week, the CBS, ABC, and NBC have not done a good job of showing the flaws of Obamacare.
And there are, and you're right. Over the past week, the existing problems with Obamacare have not gotten that kind of coverage. Now, I asked a communications director to an influential Democratic senator on Friday, is now your time to say, going into the 2018 midterms, we know Obamacare needs to be fixed. Here are our package of fixes. Yeah. And this particular person said to me, which is a problem for all campaigns, that we can't really put out the exact policies we want to pursue because then the media will shred it.
It's so much easier being in the minority when you don't